Renee, I'm going to look to you to tell me when we're ready to start, when we've got enough folk in the room. Is that the thumbs up to get started?
I think you can slowly get started. Thanks, Allison.
Yeah, no problem. Good afternoon, everybody. And I'm going to get Renee to whoever is screen sharing the slides. Is it sharing already, or just check in? You're on mute, Renee. There we go. Wonderful. Okay, we'll hear that ping ping as more and more people join us in the room. I'm going to get us started. I'd like to welcome everyone to our webinar on keeping people safe, heat response for unsheltered individuals. My name is Allison Dunnett. I'm the Executive Director and Strategic Advisor for Homelessness here at BC Housing. And on behalf of my colleagues and the fellow sponsors and those presenting today, I want to thank you for joining us in this presentation and discussion. Next slide. Before beginning, I'd like to acknowledge that BC Housing conduct our activities on the ancestral homelands of hundreds of Indigenous peoples and nations across British Columbia, each with their own unique traditions, culture, worldviews, languages, and history. In covering a topic like extreme heat, I feel it's important to acknowledge the role in supporting, where we can, our partners as we all face changes to the environment and land around us, and acknowledge the role that Indigenous nations have played in caretaking and supporting the lands for many generations. I am joining you today from the unceded traditional Coast Salish lands, including the Tsleil-Waututh, Coquitlam, Squamish, and Musqueam nations. Next slide. So a few housekeeping items for our session today. Please do keep yourself muted while the session is underway, and unless we call on you later during the Q&A portion. Please let us know if you'd like to ask a question by using the raise hand function during the Q&A at the end of the presentation. You can also ask questions through the chat function, and we will take questions there and relay them to panelists as needed. We are recording this session and we'll be posting it to our bchousing.org website within a few days. And we'll reiterate this at the end, but if you have follow-up questions or comments, you can reach out to extremeheat@bchousing.org. Next slide. We have a full agenda today. We're aiming to make the most of the 60 minutes we're all here together. We've gathered partners to share resources and guidelines for supporting people who are unsheltered. And I'd like to start by introducing you to our panel. Madeleine Maley is the Assistant Deputy Minister for Emergency Management and Climate Readiness. Misty Bath is the Director of Clinical Programs, Substance Use and Priority Populations in the Office of the Chief Medical Officer at Vancouver Coastal Health. And Amy Lubick is the Climate Change and Planetary Health Lead at Fraser Health. And Dexter Charlebois Holmes is our Project Delivery Supervisor Operations here at BC Housing. Next slide. So the focus of today, I probably don't need to say this for the folks on this call who do this work every day and work here in BC, but the 2021 heat dome was truly a kind of rallying moment for those of us within the sector. We lost community members and loved ones who passed away and were hurt by the heat dome. Since then, partners in our sector have learned, and we've changed our approach to heat response. And I will say we will continue to learn and improve our work together. Through the loss of life in the heat dome, while it was predominantly for those located inside, we know we still need to focus on challenges for folks living outside or sheltering outside in the heat. Next slide. I just want to take a second to acknowledge in Vancouver, Curtis Brick's death from heat exposure in 2009 on what has been recorded as the hottest day in Vancouver's history. This is a painful example of the challenges we face and those in our community face, and a need to do better. Homelessness, systemic racism, and a lack of coordinated response contributed to Curtis's suffering in plain sight of our community members and ultimately losing his life. We have tried to focus today's session on those who are sheltering or living outside, and those experiencing homelessness. We're going to have time at the end of the session to hear via chat or spoken question, not only questions from webinar participants, but also ideas and strategies that you want to share with partners. I'm now going to turn the presentation over to Dexter, who's going to explain how shelter and outreach providers can access some funding for heat response through BC Housing. Dexter?
Thank you, Allison. Great to see everyone here today, and really happy to see the uptick in participation and joining the webinar. Clearly lots of interest, and I can acknowledge we're in the middle of extreme heat season as well, so clear that everyone's obviously out there supporting as best we can. So just to give a little overview on BC Housing and the current processes that we have internally with the heat dome, and a few years ago, the organization got together and collectively put together some solutions for support for the nonprofits from our organization as we tried to determine the best way to coordinate mostly information and supply support. So we wanted to break down just the two channels that we are really providing support here through BC Housing. First being supplies. So we've done our best to communicate at the start of the season. We do kind of regular communication through our nonprofits throughout the season, communicating with nonprofits that are funded with BC Housing. So hopefully some of the organizations, most of the organizations here have seen some communication coming in from us, just highlighting things like starting off the season, making sure that you are getting your supplies that you need. And at this point, we're hoping that most people do have the supplies that they need to provide different cooling support within their portfolios. But the primary way that we are providing supply support is through funding, and that would be with the support of your portfolio managers, so organizations working with their MPPMs or SHAW groups. That would be where you'd request support for funding, and the SHAWs would work to identify if that funding is available. I'll go into a little bit further what kind of supply support that we do provide. And then the other piece that we've really been trying to coordinate and support on is information. So ensuring that our websites have up-to-date information, posters, material, but also just notifications going out to the sector on when extreme heat seasons are happening, and providing passive and general support on ways that you can support your clients during extreme heat season. Next slide, Renee. So here we just have a list of some of the items that we can provide funding for at BC Housing. So highlighting the focus today is for kind of outreach services. So we know not everything's going to necessarily fit the needs for our outreach services. Things like air conditioners and fans and air purifiers, no, but BC Housing also has done things for providing support for things like tents, misters, water, cooling kit supplies as well. So again, we don't really say yes or no to direct requests, but we encourage nonprofits to reach out to us with those requests, and then our portfolio managers will work with you to identify if that support can be had, or ways that you might be able to obtain these materials as well. We're hoping everyone does have their materials kind of at hand at this point, because we are in an extreme heat season. But we did want to highlight as well, and we'll put some information into the chat afterwards, how you can request supplies like this if there's a shortage, or if you're having funding issues right now. So if you are an organization right now that is experiencing a shortage of getting supplies or funding issues, we'll put some information in the chat afterwards of how you can submit those requests to us. Next slide. Another link that we'll put in the chat after this is just a link to our external BC Housing webpage for extreme heat. This is a really well thought out resource page that we put together a few years ago, but we continue to update it with our most up-to-date details. So things like how to create an extreme heat response plan, resources, and even existing webinars for more information, information for tenants and clients. So we have here an example of a tips to beat the heat pamphlet or flyer that we can hand out. So these are available for printing on our website, and they just have beneficial and helpful information that you might be able to share with your clients. Next slide, Renee. Another thing that we have on the website is just information for things like cooling kit suggestions, so things that we might want to think about giving out to clients on the street, or in rooms if they need them. So things like gel compresses, water bottles, just some supporting information, especially if you're a newer nonprofit that doesn't necessarily have experience with dealing with extreme heat. I would point you to the website just to find general information that might be helpful for you. Next slide. So kind of a checklist that I wanted to end with on just how we are hoping nonprofits will work with us or work with themselves over extreme heat seasons this year and in the future. Obviously, we're kind of in the middle going into July, but we really wanted to highlight for next year and just general years, being prepared ahead of time. So checking your extreme heat and wildfire smoke inventory, making sure that you do have an inventory on hand and you know what that inventory should be for the years. As you're working through this summer season, you're going to use some of that inventory. So making sure at the end of the season or the start of the next season that you're aware of what you need, identifying those items, restocking. And again, if you need support for funding for restocking your inventory, your MPPM or SHAW would be where you'd go through BC Housing. Proceed to purchase those supplies. Do not wait. So again, if you're at this point, you don't have those supplies and you're really struggling, we will put a link for the chat to get some support for you. Monitor the updates and environmental climate change Canada, as well as our partner bulletin. So BC Housing has a partner bulletin that we share every 2 weeks, and we continue to add notification and information on extreme heat just to make sure that our parties are updated. But everywhere that you can get them, make sure that you're monitoring those heat changes when they happen to make sure that you're prepared and getting ready for your clients that you're serving. And finally, if extreme heat alert isn't announced and your region is facing supply shortages, we will add this this distribution link or an email link so that you can reach out to us and identify specific needs that you might have. All right, that's it for me. So I believe I'm passing it on to Lisa next. Or sorry, Amy, not Lisa. Apologies, Amy.
Not to worry. Thank you so much. Thank you. So I'm going to go into a little bit of smoke and heat readiness from a health perspective. So we have folks here from Fraser Health and from Vancouver Coastal, so we're going to tag team a little bit. I'm going to give an overview of the process of what happens from the health authority's point of view during the heat event and some of our partners, and then who's more susceptible and some of those targeted resources that might be helpful. And so this writing might be kind of small, but so what happens when there's either heat warning like we just had last week or an extreme heat emergency, which is what happened during the is Environment Climate Change Canada and the Heat Committee or Health Effects of Anomalous Temperatures Committee of BC will get together, decide to call a warning or emergency, and then Fraser Health and Vancouver Coastal Health will send out packages to the partners that we have in our different mailing lists with resource packages and just a reminder of where you can go for any questions that you might have. And so we're also available to look over smoke and heat plans for different organizations if needed, if you'd like that consideration. And after that happens, EMCR, I think it's important to note as well that the EMCR or Emergency Management and Climate Readiness will often make funds available for local governments during these incidents, but that usually goes through the local governments and not to NGOs. However, NGOs can work with local governments to have that on getting some of that funding for any supplies or things that they're working on together. But I know that unfortunately that's not as, sometimes that can be challenging if what you need is staff and not resources. So those are some of the things that happen during the heat wave process. And if you aren't already on our lists, I'm happy to put the email that you can send, that you can reach out to in the chat, so you can be put on that list. So going into who's most at risk, we tend to focus on seniors, people living with chronic illness, people with mental illness, particularly those with schizophrenia, people who use substances. Here we say outdoor workers, but it's also anyone who doesn't have a cool, safe space to go. And also we do talk about infants and young children as well. And so one of the resources that we have available is our summer heat and safety for seniors and people with medical conditions. And one of the reasons why I think it's important to highlight seniors is that I know that we have a growing population of seniors experiencing homelessness. And as we age, our bodies are less able to deal with heat. And we also may have more compounding conditions. And so as our lungs are already going faster, our hearts are already pumping harder in order to help us just continue going, as well as potentially our kidneys. You put the heat into this mix and it becomes very dangerous for people with their systems being overloaded. So we have a lot of guidance for how to take care of our elders and folks who may be experiencing some of these issues. And that can often overlap with people who are taking certain medications. So this is a poster that's available from the BC government website, and it outlines some of the medications that people might be on that may interact with heat. So it can make it easier for people to dehydrate or overheat, or just interfere with your cooling systems in general. So it's really important that we know who might be taking what and how to keep them cool. Just checking on them. Nobody should stop taking medication that they need. And I'll just flag here that some of the medication that is considered are things like antipsychotics or antidepressants. Again, people shouldn't stop taking them, but if someone is on them, then it's really important to keep an eye on them. And we talk about people with mental health and substance use considerations. One of the challenges that we saw during the 2021 heat dome was that we lost a disproportionate number of those experiencing schizophrenia. So, for example, we saw about 8 to 13% of excess deaths of people who are dealing with schizophrenia. And that's very high considering that only about 0.78% of people actually experience schizophrenia. So part of this could be because people living with schizophrenia, especially if they're having an episode, may not be aware of what's going on around them. They may have challenges sensing the heat. They also may be taking medications, as I mentioned, that make them more susceptible. And if you are living with mental health challenges, it can be hard to have a stable income. So that's kind of the perfect storm. So people who are taking care of those with schizophrenia should make a plan. And there are some guidance documents on toward the heart. It's also important to have care plans for anyone who might have mental health challenges or be using substances during a heat event, as those may also interact with heat. And I believe Misty will talk about that a little bit more. And also be aware that heat is associated with increasing suicidal thoughts. And so that's another thing to keep an eye on. And so I'd like to just highlight a couple of resources for planning. There is some guidance for community organizations available, again, on Toward the Heart. And that will help you come up with a plan for your organization. One of those is to check in on people. We'll talk about it in a second. And all of these resources are available on our website. So Fraser Health has an extreme heat and smoke guidance website for those supporting unhoused community members. We've just updated it, so hopefully it'll be a lot easier to read now, but it does go over identifying who's at risk, steps to take before a heat event, actions during a heat event, long-term cooling strategies, making an outdoor cooling station, mental health considerations again, and also wildfire smoke. And as I mentioned, one of the main things that we've been promoting is heat check-ins. So if there are people identified that are vulnerable, there's guidance for what questions to ask them to help keep them safe. There's a individual guide from the National Collaborating Center, but also a support framework for organizations that's from both Fraser and Vancouver Coastal. And these are really important to just encourage people to be looking in on those who might be most vulnerable. And I'll mention also that there's some videos from Vancouver Coastal on how to do heat check-ins, which is very helpful. And I know Misty's going to talk a lot more about smoke, so I won't get into that right now, or too much. But I did want to highlight that, as it gets smokier, folks who are living outdoors are quite a bit at risk. And so we do hope that organizations will encourage them to find a clean indoor shelter space especially if you're aware of air quality warnings. And there are a number of apps which can help you keep up to date on that. For those who would like to create clean air spaces, but can't afford commercial cleaners, we're promoting do-it-yourself air cleaners, which are very inexpensive and can actually be quite effective. And we do have guidance on how to make those on our website, sorry. If folks can't find a safe inside space, or they don't feel comfortable, or need to be outside for whatever reason, you could consider providing or encouraging masks, especially such as N95, understanding that they're most effective if they fit people properly. And I know that's not always as easy to judge. It may also be important to highlight that masks are not safe to sleep in. So if people are sleeping outside when it's smoky, it's important not to be wearing a mask at that time. And also to understand that materials and bandanas aren't very effective. But there are some guides on what is effective on the BCCEC website. And these are just some advocacy documents that I wanted to share with folks. We do have some documents on if you are supporting anyone who's having trouble with their strata or landlord in particular, guides for cooling spaces, and that's from Vancouver Coastal Health, and also some policy tools for cooler spaces. And I know this might be for a bit not in the time of the heat, but potentially advocacy for next season. So I very much appreciate all the work that everyone here does. And I will pass it over to Misty to set a bit more context and give some really good examples of what can be done. Thank you.
Great, thanks so much for having me and for setting the stage and the context, Amy. My name is Misty Bath. I'm the Director of Clinical Programs for Substance Use and Priority Populations. We're a department within public health here at BCH. And in my scope of work, I have the privilege and opportunity to work with a range of outreach teams across our entire region. So that spans not only Vancouver City Centre, but also the North Shore, up the Sea to Sky corridor, including Squamish, Whistler, Pemberton, the Lower Sunshine Coast, and Quebec, and our coastal rural regions of Bella Bella and Bella Coola. And the work that we do with those outreach teams across the region is really about supporting those teams to pivot and support the clients that they're already working with around preparing for heat events and actually really checking in and doing some heat check-ins during a heat emergency or a heat warning event. And also readying our teams to be able to pivot for any emergency that could be floating up at an emergency operations center. So knowing that there could be some critical event in our communities where additional hands may be needed, and hoping that our outreach teams, because they're a little bit more nimble than teams that are working in brick and mortar sites, are actually able to pivot and meet those needs should they arise. So it's really just preparation and planning and a bit of a heads up that we're trying to coordinate across the region. So just in terms, I've done a bit of our territory acknowledgement here, but just also wanting to acknowledge that we have 14 First Nations communities across our region, and seasonal readiness planning really needs to take all of those communities into consideration. And with the climate scientists within public health, we've had an opportunity to build some stronger communication pathways with our First Nations partners in those communities, in the hopes that we're, better able to communicate to our partners in a heat warning or a heat emergency scenario. So just in terms of an overview, I'll provide a little bit of context about our work and what outreach staff need to know in terms of practical information, both for pre-season readiness and what to do or to consider during an actual heat event as well. So moving on to our next slide. Just in terms of some context, we know that during the heat dome, there's so much proactive learning that happens after events such as these, but after the heat dome, we saw that there was a lot of concentrated visits to the emergency department by certain residential areas. So definitely, the inner city was heavily impacted, and we saw residents in those settings visiting the emergency room more frequently during the hottest days of that event. And then with our next slide, you'll see that we also saw an increase in drug-related mortality in our region over that 3-day heat period as well. And we'll talk a little bit more about substance use and how that impacts vulnerability to heat injuries, especially for folks that are precariously housed or unsheltered. And then in terms of our next slide here, we just also wanted to share, and I know we're all hearing this message in the media and internally, likely within our own organizations and at the kitchen table, that our context related to the realities of climate change are really only going to worsen or become a lot more frequent. Urban environments, especially for our larger urban centers, there is the reality that folks are living in precarious housing settings, including many instances where folks may not have access to formal housing or shelters. Our urban environments have been likened to concrete jungles given the lack of shade or greenery and the ability of concrete to really absorb and release heat during our hottest days of the year. We know that folks, especially those that obviously aren't housed, are spending a lot of time on the streets or in encampment settings, in addition to any existing housing stocks or shelters, sometimes not able to readily cool down fast enough. And then again, finally, acknowledging that given lots of folks are spending quite a bit of time outdoors, it's not really easy for folks to leave their designated spaces or their belongings to move into cooler settings for fear of, losing the possessions that they do have access to. I mean, that's touching on our urban environments, but we also know in our more rural settings or smaller city centers, there might be more greenery and more shade, but often human resources are a lot more stretched in those settings. So there may be less ability to have some roving street outreach. Rural teams that we've worked with in some of our more rural remote settings share that, some folks are really camped out in some isolated spaces that can be deep in the bush, difficult to access. We know that some of our teams are engaged in some mapping exercises, which is hopefully supporting better outreach efforts. But access is definitely more of a consideration in our rural settings. And often it's just difficult to readily move people to cooler settings or to cooler spaces because of the distance that's needed for travel. And then finally, I also just wanted to share that we know there's increased health risk for those that are precariously housed, specific to concurrent substance use, existing mental health conditions, pre-existing chronic health conditions, mobility challenges. So all of this makes our work supporting clients during the heat and smoke season all the more challenging. We can move to the next slide. So I just wanted to touch a little bit about practical information to know, and perhaps this is already known and just a review, and hopefully that's it, so I won't spend a ton of time on it. But I think we've lost access to our slides. I don't know, Renee, if you're still able to present them. And I'm just on slide 8 of my deck anyway, sorry. Yeah, this is the one. Thanks so much. Okay, so just in terms of some practical information, I think this is hopefully a familiar slide to folks here, but with our teams and with our staff, whether they're working for nonprofits or with health, it's really important to be able to distinguish between heat exhaustion and heat stroke symptoms. Heat stroke being evidenced by a really high body temperature, fading or a change of their consciousness, confusion, lack of coordination, and really hot and red skin. Heat stroke is considered a medical emergency, and we really want to make sure that we're supporting those individuals to be seeking out a higher level of care. So I think one of the best learnings, again, from the heat dome was encouraging all staff to recognize that heat stroke symptoms don't need to wait for an EHS or emergency health or a paramedic attendant for transfer. If your agency has the ability to move people to an urgent primary care center or to a local emergency room, a non-medical professional can make that move. We don't need to wait for a medical professional to assess and transfer. So that's a nice key kind of practical piece of takeaway information. And then alternatively, heat exhaustion, less severe, evidenced by skin rash, heavy sweating, dizziness. Sometimes there's nausea and vomiting and a rapid heartbeat, headache, difficulty concentrating, cramping of muscles, a lot of thirst, and decreased urine output with darker urine. So these folks are suffering from the heat for sure, less severe than heat stroke. Really important to move that individual to a cooler space, remove excess layers of clothing, give them some water to drink. Again, key ask here being, let's move this individual to a cooler setting. Next slide, please. Wildfire smoke, just touching on this again in terms of the symptoms. So, sharing with our staff, the more minor to moderate and severe symptoms of wildfire smoke. So again, in terms of minor and moderate symptom presentation, you'll see sore throats, eye irritation, runny nose, mild cough, some mucus production, maybe some difficulty breathing as evidenced by a wheezy breath, and headaches are also super common with some mild symptoms, with more severe symptoms presenting as shortness of breath, a cough, dizziness, chest pain, and a feathery kind of heart rate or palpitations. So anyone with those symptoms, the more severe symptoms, ought to be kind of monitored, but also find a way that we can get those folks assessed by a medical professional. Again, whether that's through an urgent primary care or through the emergency department, or if you have like local healthcare kind of embedded within your organizations, if there's a staff on site there or an outreach service, that's all relevant for some of these severe symptom presentations. Next slide, please. So just in terms of substance use and heat illness, we know, I think it's quite important to know that there's different substances have different impacts in heat. So just quickly here, for folks that are using opioids, we know that the use of opioids might actually impact a person's ability to seek shelter from the heat and hydrate. Additionally, for those folks that may not be using opioids from the street but are on opiate agonist therapy, we know that OAT can cause a lot of sweating. So folks on OAT will need to hydrate sufficiently and continue hydrating themselves throughout the day. Opioid withdrawals, so for folks that don't have enough opioids on board to meet the threshold of their regular use, we'll see that in a heat setting, folks will experience a runny nose and eyes, sweating, nausea, vomiting, and diarrhea, all of which can lead to dehydration. And so they also have higher hydration needs if in a state of withdrawal. Stimulants increase your body temperature, it increases sweating and can cause an individual to amp up, and that can, and as I mentioned there, it can lead to over-amping. So again, really important, if possible, to help those individuals hydrate or to cool themselves. And we'll talk a little bit about some practical solutions there. Alcohol increases urine output, makes it hard for the body to cool down. And generally speaking, substance use can make it just all the more challenging for an individual to know if they're thirsty or if they're overheating. So again, I guess a little bit more onus for some observation with outreach staff and some guidance of in the moment with clients around how we can support them with their hydration needs if they're using substances. Oh, and sorry, I just mentioned this. This came about through some observations with our outreach teams, but for some of our clients who are actually using fentanyl patches versus oral agonist therapies, we know that the fent patches, because of a lot of excess sweating, can start slipping off, which could lead to opioid withdrawal because folks aren't getting, the medications they need transdermally through their skin. So we've had a lot of recommendation from our outreach staff that we're securing those patches with additional tape and there's a product called like Third Skin, which you can find at almost all of the local pharmacies, which kind of really helps secure the patches to bodies, especially during very, very hot days. Next page, please. So some planning activities to consider before the heat hits. So the next slide shares the Environment and Climate Change Canada weather app, the CAN app. This is such a great app. We always encourage our outreach staff to have it loaded onto their phones. It's a really great way to stay informed and to know what heat alerts are noted for your area. So great. So I recommend that everybody has that loaded to their phones. Additionally, we also stay on top of all of the municipal resources, and that's our next slide. Given that municipal resources look different in every region of VCH, and no doubt all across the province, municipal resources related to heat look different everywhere. It's really important to check in with your individual municipalities for what's being planned for cooling. Is there anything being planned for additional shade? Are there additional water infrastructure or water stations coming online? Are there additional shelters that are being planned for smoke? If there's anything different than what's being planned for cooling. So it's great to check in with your municipal resources and the resources that are located closest to you and the populations that you're serving. Next slide, please. These resources, I won't go into a lot of detail just because you can easily access them on the Toward the Heart page that was developed by the BCCDC, but they're really great practical guides and resources for folks that are using substances. So if you have staff that are supporting folks that are using substances, whether they're precariously housed or not, these strategies can apply for a whole range of settings. And again, it breaks down how the use of stimulants and opioids and alcohol all impact an individual's health status during an extreme heat event. And then there's some really great practical harm reduction tips to consider during a heat event or a heat alert. So the next slide, please. There's also a suggested guide on supplies that can be stocked up to prepare in advance. And I think these are all great and supplies that we commonly use also in outreach settings. Next slide. I think for settings where there isn't a lot of natural shade, and this is something that we want to do a bit more planning for in our region here in Vancouver City Centres. How do we plan in advance to support more shade, especially if you're in an environment where there isn't a lot of greenery or natural shade structures? If organizations are able to put some thought into shade structures that they could support locally, I think that could go a long way, in addition to whatever the municipality might be planning. And then finally, our last slide talks a little bit about cool down science, and we spend some time educating our staff and our teams to recognize what is the most effective or science-backed methods for cooling an individual. And it's really great to share some of these practical tips that in terms of hydration, it's just best to drink water. And although folks love a glass of ice cold water, maybe with ice cubes, the fact is it doesn't have to be super ice cold. Even cool water will go a long way for simple hydration impacts. In fact, folks will probably consume more water if it's cool versus freezing cold. So just a little tip there. And then we talk a lot about cold draping and soaking because it's really effective and accessible for folks, hopefully a bit more accessible for folks. So teaching folks that you can use a towel, a cloth, or a t-shirt to get it wet, and then to drape it over larger parts of the body, like your chest, your groin, the legs, and the back. And that can go a really long way in cooling the body down. And once an individual feels that article of clothing is drying or it's feeling warm to the touch, it can be re-soaked and reapplied, and it can be quite effective. If folks are able to soak their feet in a cold bath or a cold body of water, that's also effective. Ice packs on the back of the neck. Misting, although popular, is a little bit less effective than cold draping, so we really promote cold draping. And then for our next to last slides here, just in terms of activities during the heat, if it's possible in settings to introduce some increased outreach efforts, including, we call it kind of roving street outreach, where we're just checking on, the local population that we know is not adequately housed or precariously housed. We often will rove with our regular harm reduction supplies, but also cooling supplies as well. So often we'll have water, towels, hats, and SPF. And that's sort of been our core stock of supplies. We also will stock those same supplies at encampments, and we'll check in on those encampments on a regular basis to ensure that folks are doing well. And we continue to do heat check-ins for vulnerable folks, whether there are existing clients or, as I mentioned, with some kind of roving street outreach. If we do come across folks that are suffering from heat exhaustion, we're offering physical transportation to move people to cooler settings. And, surprisingly, people are often happy to take us up on it. I mean, I'm not saying that it happens universally all the time, but I think the efforts are appreciated, and our teams certainly have been moving people to cooling centers, and I think that's been impactful. If there's an ability to create some of those additional shade structures, as I mentioned, that's super helpful. Continuing to utilize municipal cooling and water resources, and understanding what's being planned for smoke. Next slide. This is finally, I know that Amy mentioned the heat check-in or the support framework, which I think is a wonderful document. And we also do something like very, very similar, where we're sharing with our staff some practical information around the signs and symptoms of heat stroke versus heat illness, and then the practical tips for what they need to do next. So I think that's all I have left, and I will pass my presentation over now to Madeline.
Great, thanks very much, and good afternoon, everyone. So I'll start off just by saying busy slides, lots of information on them, so I won't read it out, but just going back to the heat event in 2021, one of the outcomes was that the BC Heat Committee was established in 2022, and that was to support the planning and response to heat events. And the heat part of Heat Committee means the health effects of anomalous temperatures. This committee is led by BC CDC and the Ministry of Health, but also includes representation from other agencies such as mine, ENCR, but also Housing and Environment and Climate Change Canada. So one of the things this committee did was to create the HARS, which is the Heat Alert Response System. And so I just wanted to talk a little bit about the two primary heat events. So the first is the heat warning. You can see that up on the screen. So it's very hot. Get 1 to 3 per summer. And it's all about daytime temperatures exceeding thresholds, and overnight temperatures stay above established minimums. And certainly we've experienced those over the last few weeks. And those threshold and minimums are set by region. It's different in the interior than it is on the coast, and different in the north. And those are declared automatically by Environment and Climate Change Canada. The next level is an extreme heat emergency. So not just a warning, but an emergency, and it's very hot. And again, but this one is 1 or 2 per decade. So that heat warning criteria has met, and it's declared by the heat committee. This year they added a new subcategory, which is a special weather statement for heat. And that's issued for the first heat event of the year, where temperatures are close but don't get to that heat warning threshold. And that's based on the research that the first heat event of the year does carry a greater chance of heat-related illness, which is, we've been talking about before populations have an opportunity to acclimatize. So next slide, please. And just a quick look at what the temperatures look at. So you can see that it depends on the region. Those are the regions on the left, and the daytime highs, and then the overnight lows. And so what we're really looking at when you start to decide whether it's a warning or an emergency is making sure that the temperatures are above for the daytime, but also don't go down below the lows, because that cooling does really help folks. Next slide, please. So that was so that is the information, and then the part that I think you're interested in is the so what. So how does emergency management and climate readiness support response to heat events? So the first piece we do is we provide planning and response advice to communities if requested by that community. So they may ask us to support them in planning or answer questions. We amplify yellow and orange weather notifications to communities. So Environment Climate Change Canada will issue notifications that a heat event is coming, and we provide that to emergency management practitioners within communities so that they can start to plan to establish their cooling centers or whatever their other actions will be. We then amplify warnings. So again, we're providing information through we will send emails out to emergency programmers in communities who might phone them directly. And we also provide information to the public through Emergency Info BC. And of course, the information from Environment Climate Change Canada also is amplified through the media and through other channels. We also will organize regional coordination calls. So those calls will be for emergency programmers in communities, and we'll have a call to answer questions, to provide more detailed information, to support community response in these events. And again, we talked about the amplification. So as well as amplifying through those other methods, direct to communities or through Emergency Info BC, we also can issue intrusive emergency alerts, and those go radio, TV, and cell phones, and that is under the recommendation of the BC Heat Committee. We issue emergency alerts also for things like wildfires, for flooding. We've not issued one for heat yet, but in the event that it was an extreme heat event and the committee recommended it, we would do that, and that provides information. And it is when you put an alert out, it is really information to tell people what's happening and what they should be doing. So it really is safe for those significant events that would create an impact to public safety. Next slide. So a few other things we do, and you already heard it talked a little bit about, we reimburse communities for incremental costs. And so there has to be a weather alert in place for a warning or a watch, which is rare, or a special weather statement. Also, a community may develop their own extreme weather plan, which will have some triggers in it as well. So the kinds of things that we support are cooling centers, so facility wages and wages, as well as facility costs, bottled water, cooling device rental. And then we also, if a community provides us the information, we'll put the cooling center location onto our Emergency Info BC platform so people can find it. Our policy 5.14 does explain all those pieces. don't know if I have another slide. Let's check. Ah, I do. So what's happening now? I already was just saying to you that you're already experiencing the heat. So this map shows where the kind of what's happening. So you can see high in the lower mainland, where the medium is along that east coast of the province, and then the balance is sort of green, but there are areas with no data. So I expect this heat event is going to go on through the weekend. I know that certainly where I live in Kamloops, we're going to get warmer temperatures going into the weekend. And then there'll be what we would call as a breakdown. So the temperatures will drop, might be unsettled. So right now we're supporting 48 community cooling centers across all 6 of our EMCR regions. And most of them, no surprise, are in the Southwest and also in Vancouver Island. As well, we know that communities have posted over 300 public cooling space locations. So those would be things like malls, libraries, pools, all those spaces that communities make available for people to find some relief for from the warm weather. And I'll stop there, Allison. I think back to you.
Thank you, Madeline. I appreciate that. And we knew we had a lot of slides to get through, and we knew we were going to up against a tight wall here in terms of time for questions. We've been monitoring the questions in the chat. I want to just thank all the presenters. And if you haven't seen it in the chat, we will make a PDF of this presentation and send it out to participants so you can go back and look at different pieces. Really heartened to see that, Madeline, your last slide on the map of cooling centers. We already had somebody in the chat sharing that as well with other partners in this meeting, which shows me that the information is getting out, which is terrific. As the focus here really for the session was on those of you doing direct service, supporting direct service provision to those who are unsheltered, through our outreach teams and shelter teams. I want to maybe make sure we focus on the questions that are on that piece. So I'm just going to quickly ask our health partners if they can see the questions in the chat, because there were some very specific ones. I think from Chris Patullo, I'm just going to take note of here around heat events and coding, and another question from Chris around documentation with response to the statement about transportation of non-medical professionals. Is this documented anywhere? I expect the vast majority of organizations would be extremely hesitant to take this role on. I'm hoping maybe Amy, Misty, you might provide a response to Chris on that one, because it's very, very specific. If you can in the chat would be great. Is that, Misty, is that good? So your camera turned on, is that good?
Yeah, I don't think that there is. I mean, I don't believe that there's anything that is specifically written down. I would need to take that back to our medical health officer. We've heard a very clear directive from them for the work that our teams are supporting. I don't believe that it's written down. So I can just take it back and see what the climate group thinks about that. And if there's any benefit or value in putting that out in a more kind of formal way in the public domain. So I'll have to take that one back.
Okay, great. Thank you. So I'm going to go to the beginning, and the first question there was questions because we've got Fraser Health and Vancouver Coastal Health here about, do things work the same for Island Health? And I think if we can flip back in the slides, Renee, this was, I think it was Amy's slide early on with kind of the three-prong piece. And I'm going to invite those on the call who may know the level of difference or similarity to kind of chime in. Keep going, keep going. That one. Yeah, no, back the arrow. So I think this was the slide that Kathy from the United Way was asking about. Does it work the same in the island? I don't know if Amy, if you can, I think this was your slide, if you can speak to that at all, or Madeline as well, I think, because it's EMCR is on here as well.
Well, I can just say from our point of view, not sure what the process is for.
Well, you're hard to hear, Amy, for me. I don't know what others.
Sorry, I was just going to, can you hear me now?
Yeah, yeah.
maybe I'll type it, but I don't know the process for the other health authorities, I have to say.
And for EMCR, our processes should be consistent across the province in that we work directly with communities and apply our policy directly with communities, acknowledging that different communities have different plans, different needs, but our approach is consistent.
And maybe if there's anyone here from Island Health, Northern Health, Interior Health, happy to have them chime in. Otherwise, I think it's a great question, Kathy, that we can kind of confirm if there's anything different and get back to you on. Okay, the next question was around accessing supplies and resources from Lauren, and in the same vein from Joe. Can you only access supply resources if you're part of a registered nonprofit, or can community organizations have access to these supplies as well? Joe says, yes, wondering this as well. There's lots of community mutual aid that covers these supplies. It'd be hugely beneficial to have these folks connected to these supplies. And I might ask Dexter if you want to jump in here in terms of answering on the kind of BC housing side. This is your slides on the connection with our nonprofit portfolio managers. I also just want to acknowledge the space, and I think this is one of the real drivers of starting this conversation. And I want to thank HSABC for encouraging us to bring partners together on this. The work to meet the needs of people outside and unsheltered is covered by a variety of organizations, service groups, and I think that makes it quite complex, actually, in terms of funding and connecting folks with funding. So, Dexter, can I maybe just flip to you in terms of the boundaries I think we have, unfortunately, in place right now on what we can fund through BC Housing for this?
Yeah, thanks, Allison. Yeah, to reiterate to people on the call here, the process that we're working with internally is supporting our regional offices, which work with nonprofit organizations to provide funding. So the way that we're able to provide funding is through organizations that already have funding agreements with BC Housing. Unfortunately, we don't have additional support outside of organizations that we're already providing funding for at this time. Really encourage folks to work with municipalities, supporting them in different capacities. And I see some interesting conversation in the chat of maybe trying to find different ways where municipality funding could work with the nonprofit organizations as well. At the level that we are kind of passively supporting at the provincial lens, as Allison noted, we are seeing some gaps as well. So I encourage folks on this call. We have that extreme heat inbox, extremeheat@bchousing.org. We'll take information. So if you have information or want to highlight maybe gaps within your area that you feel like could be identified where BC Housing might be able to improve support in the future, or just gaps that you feel like with funding that you are receiving from BC Housing, maybe not being able to fully meet your needs, send that information to us at the Extreme Heat mailbox. We'll take it. We're working at kind of collating all the information that we work through each year and trying to improve our services for the next year. So again, learning on these challenges every year, and want to make sure that we can provide future support, but also identify that we are limited and being able to work primarily with providers that we already are only providing funding to. Hopefully that helps, Allison.
Yeah, it does. And I think we will just pull then, Sherry has asked in the chat as well, the process to access funding given to municipal governments. And so Madeline, I don't know, this is not really, this is a little bit about how do folks connect and advocate inward, I think, to municipal partners who you're also reaching out to ensure they're aware of opportunities to seek funding and resources. So any suggestions on that?
Yeah, I mean, I think the only thing I can think of is just reaching out directly to the community, and I know there's good relationships already within communities. That I'm not sure I could suggest anything more than that. I do know also many NGOs are also linked into our BC. We have a committee of NGOs that also works together during response, and I can't recall the name right now, but I will send that to you. But I think just working directly with communities is the key. Thanks.
Yeah, thanks. I just want to also double down on Dexter's ask there. If through the recent experience with heat response or ongoing, you've got specific concerns about gaps you're having in terms of funding and resources, please do send those to extremeheat@bchousing.org. I think that's one of the only ways we can kind of pull this together as partners and ideally identify future resource streams that community partners can connect with. And then just wanted to check to make sure we were really clear on this, because I see some questions about, Kathy says, thank you. I look forward to seeing the list of cooling centers on the island. And Julie has said, what's the process for having cooling sites added to the emergency map for BC for sites that aren't EMCR funded, or I guess aren't delivered by, say, a municipality? And Madeline, if you can kind of speak to that, would I be right in understanding that if a cooling center gets kind of funded and supported via EMCR, is connected in that way, it will end up on the map? It will be there visible? Or can you maybe clear up a little bit of that?
It's communities that provide the list to us. So I don't know if we accept them from other organizations. I'm happy to check on that, but it's communities provide them. And so it's not actually got to do with funding. It's just got to do with them providing the list. And so I think there are quite a few cooling spots that are just not posted. We're trying to work to get as many as we can just to make them visible. But let me check on that, Allison, and I can get back to you on that. Thanks.
That's great. Thanks, Madeline. Yeah, really understanding your entry point is the municipal or local government community partner. Amy, I see your hand up. Do you want to jump in?
Oh, thank you. Just to say, if you can hear me, I put a link in the chat. BC 211 also keeps a shelter list, and it's more for nonprofits. But it is only, unfortunately, like a Metro Vancouver out to Chilliwack, I think, region. So it's not for all communities. I don't know if there's a wider provincial map, but hopefully that's helpful to some folks.
Thank you. Is there a list? Julie's asking, Dexter, another question for you. And I know we're over time, but I'm going to push us all to stay a few more minutes to try and get a few more questions in because we ran long. Is there a list available of nonprofit organizations that receive BC Housing funding for cooling supplies? It's a really interesting question.
I'm unfortunately not feeling like I'm able to give the best answer on that. BC Housing has a wide variety of organizations that we partner with and fund, and it's not necessarily simple to get a full list of that or be able to share that directly. So I would say, again, if you have specific questions, I'd encourage you to send a message to that Extreme Heat inbox, and we can look at trying to provide some support or information. But at this time, I don't feel like I can give a specific answer to that.
Sure. And I would just say, if you're like a real proactive community partner, you probably go on the web and figure out what local nonprofits are connected to BC Housing in some way. And if you wanted to reach out and connect with them as an entry point on some of that, you could try. I think that's just an option that you could explore. But right now, as Dexter mentioned, we don't have funding directly for that. I'm just scanning. There's a question here, another question from Chris, possibly having this included in the emergency map. I think, Chris, are you asking about shelters being added into the EMCR map? I don't know if Chris can come off. I don't know if Chris is still here. Maybe Chris has had to.
No, I'm here. It just wasn't letting me come off. Yeah, no, I was making a suggestion to Amy to speak with EMCR and GOBC. GOBC are the ones that manage EMCR's maps, like the central cooling map that was mentioned earlier. So the types of resources that are included on that cooling map are quite wide and diverse. Like there's fountains, and then there's misters, and then there's shelters and cooling centers and so on and so forth. So it would be very easy for GOBC, if EMCR acquiesced, to simply add another layer. So it's a different type of cooling resource, because my understanding is that these shelters that you have here, which is this excellent compilation, they're generally intended for people that need shelters. So you would want to direct people that are requiring shelters to that, and of course you'd want it to be widely available to service providers, so they could have a shelter layer as a entirely independent layer from other types of cooling centers on that centralized map that you're talking that we posted earlier, so that, as you said, it would be widely available for people. So just a suggestion, trying to connect the dots between the two types of service providers and get the information more widely available.
Great suggestion. Thank you, Chris. I know I'm not going to call on you, Daisy, unless you don't want to chime in on shelter maps and layers, but I mean, we'll take that one away. It's a good, I think it's an interesting recommendation.
Yeah, sorry, Alison, just very
Yeah.
quickly, BC Housing is already working with GOBC and UMCR on something.
See, I knew you had something in the back pocket there, Daisy. Amazing. We are over time by now, 6 minutes. Maybe if we could just close the screen share for a second. I just wanted to take a,
Allison,
yeah.
we actually have until 2:45.
Oh, do we have to? Oh, great.
Yeah.
Oh, fantastic.
Yay.
Okay, sorry. I don't know why on mine it said it was shutting down. Other questions, PDF, I'm just flipping through. Has anybody asked a question that feels like we've missed you in the thread here? Looking, I think there was one. Chris, I think you had one other question early on. You said, were the ED visits during heat events for heat-associated systems, were they coded for heat? I'm not totally clear on what part of the presentation that was connected to. Chris, do you want to?
Right at the beginning there, I think it may have been Vancouver, but there was a map that was being shown of the region, and pardon the pun, it was a heat map of what appears to be the source location of emergency department visits, i.e. the home address of people that ultimately ended up in the emergency department. And so it was just showing a map saying, during the heat event, we had a lot of people that went to the emergency room. And my question was, while I think it's all safe, for us to assume that the heat event was the thing that actually caused people going to the emergency department, what was the data derived from emergency department coding, where it was like, oh, this is the number and volume of people that were presenting to the department with heat issues? Or was it just generally, this is how many people went to the emergency department? I'm asking because we're in the middle of an extreme heat vulnerability assessment, and if they were actually coded for heat, it would be really useful data for us to get a hold of. So I was being a little bit selfish there, trying to see if I could dig down it further. I hope that makes more sense.
Well, that's great, Chris. Do we have an answer from our health partners? It's Amy or Misty. Thanks, Amy.
Thanks. I think that was the VCH slides, and I think Misty had to go at 2:30. But I believe those are coded for heat. Heat coding is a little complicated. So sometimes people come with compounding factors, and really with the, if you remember the death panel review, the coroner actually had to go back and double check all of the deaths that came in around the time of heat. But they often do get coded for heat. So if that's helpful.
No, it is. And I was asking very precisely because of how difficult it is to code. So if we actually ended up with a data set that kind of panned out to being definitively coded for heat, it'd be very useful. So thanks. I'll chase that one down.
We've got 5 minutes left in our meeting. I did want to just do a check-in here. One of the things that we were thinking about putting this session together, we did do BC Housing, and many of the partners who presented today had done sessions earlier this spring to prepare for heat. And so just wanted to get a sense, and maybe if folks could let us know, maybe through a emoji reaction, thumbs up, if you already attended the heat webinar that was done for the housing sector nonprofit partners that was put on in coordination with the Heat Committee, BC Housing, others. If you could just do a little reaction, we're trying to get a sense of whether we're reaching a different group for this one. So you can give me a emoji and a reaction thumbs up if this is not your first, that you were in the earlier sessions. That would be very helpful. Since I'm not seeing a lot, it's making me assume this is new material, and many folks here, this is the first heat webinar they've come to, which is a good sign that this was a good addition to the outreach. Oh, I've got a few thumbs up, a couple thumbs up. Okay, great. 4 more minutes left. I do just want to put it out there. If there's like, we do know we're just completing and entering heat events right now. If there's anything folks want to highlight for partners on this call that you haven't already, put that into the chat or raise your hand. Happy to take comments as well from the group. Checking in the chat again. Yeah, great. Okay, first one. Any other hands? No? I think if we're good there, I'm going to just wrap us up to say, really do invite you to share feedback on the recent heat wave. If you don't want to do it on the call, or if you have it in the coming weeks, we would love to continue to get information through the email address that's been shared in the chat. And previously, we will send this out as a PDF to everybody who attended today or who registered for today. And yeah, we can only support and provide information where we know there is information needed. So really view this as a community conversation, and please continue to send information into partners. But thank you everybody for attending and participating today.
Thank you, everybody.